Neurological exams evaluate one or more aspects of nervous system functioning. They help confirm or rule out disorders affecting the brain, spinal cord, and nerves. It also helps neurologists to track progress of neurological disorder treatments. In the first few minutes of initial nurse-patient interaction, assess the patient's general appearance, posture, ability to walk, personal hygiene, and other general survey assessments. When asking the patients to perform specific neurological tests, it is important to demonstrate movements for the patient. The equipments to be used in the neurological assessments are pen light, Snellen chart, tongue depressor, cotton wisp or applicator, percussion hammer, coin or paper clip, and substances to smell such as coffee, and substances to taste such as sugar, salt, and calamansi. Good day! I am Hannah and I am your nurse for today. For verification purposes, could you please state your full name and date of birth?
I am Chandra Julia Igando. My birthday is July 28, 2004.
So, Ma'am Julia, today I will perform a neurological assessment to check if your nervous system is functioning well. First, I will perform a mental status exam and ask you some questions. Then I will proceed to assessing your cranial nerves, motor strength and coordination and balance, sensory function, and reflexes. These tests require you to sense some sensations and to move about. Is that okay with you?
Yes.
Okay, so perform hand hygiene and other infection control procedures. Then provide patient privacy by closing the doors and windows. Then ensure patient safety. First, I will get a subjective assessment of the patient's neurological history. So, ma'am, do you have a history of neurological diseases such as Bell's palsy, meningitis, or Parkinson's disorder?
No.
So, do you have any current neurological concerns such as forgetting happenings that happened recently, or weakness or absence of sensory or sensations and movement?
No.
So, okay. While performing the interview, assess the patient's behavior, language, mood, hygiene, and choice of dress. And note any visual and hearing deficits. In this case, the patient's behavior, language, mood, hygiene, and choice of dress are appropriate, and there are no visual and hearing deficits. Hence, all are normal. Then we will now move on to evaluating the mental status of the patient and assess the patient's level of consciousness, orientation, memory, general knowledge, arithmetic skills, and comprehension of abstract relations and judgment. So, ma'am, I will ask you some questions. Okay, is that okay with you? Can you tell me your name?
My name is Chandra Julia Igando.
So, where are you right now?
At home in Calatagan, Catanduanes.
What is the date today?
April 12, 2020.
So the patient is alert and oriented to person, place, and time. I will now assess the patient's cranial nerves. For the first cranial nerve, or the olfactory nerve, I will let the patient smell something and let her identify what it is while her eyes are closed. So, ma'am, with your eyes closed, I will let you smell something and you identify what it is, okay?
Okay.
So now close your eyes.
Smells like coffee.
Okay, you are correct. The patient can identify what substance it is when I let her smell the coffee. For the cranial nerve 2, or the optic nerve, I will use a Snellen chart to assess the patient's vision. Mom, can you see that chart over there?
Yes.
We call that the Snellen chart. You must cover one of your eyes, then read the lowest line that you can read. D, E, F, B, O, T, E, C. Then repeat it again with the other eye. Then again, read the lowest line that you can read. D, E, F, B, O, T, E, C. Then, without covering your eyes, read it again, the lowest line that you can read. D, E, F, B, O, T, E, C. Okay. For the cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens nerve, which innervates the eye movement. I will test first for the patient's eye movement by letting the patient follow the direction of the penlight using their eyes only, with their head laying in still position. Okay, ma'am. Follow the direction of this penlight with your eyes only and your head still, okay? Then I will move it in 6 cardinal fields of vision. Okay, the eye movement is normal and intact. Then I will proceed to testing the pupillary reaction to light. I will approach the patient from one side and shining light to the one pupil. Okay, the pupil both pupil constricts, and to the other side, other eye. Okay, both pupils of eye constrict in reaction to light. I will now test for eye convergence and accommodation. Ma'am, please follow the direction of this penlight and look at it while I move it towards and away from you, okay? Okay, so pupils are equal, round, reactive to light, and accommodate. For the 5th cranial nerve, or the trigeminal nerve, I will first test for the sensory function by lightly touching cotton wisp on the patient's forehead, cheeks, and chin with the patient's eyes closed. So, mom, with your eyes closed, I will lightly touch this cotton wisp, and you must say now. Say now.
Now.
Now. Every time that you felt that the cotton wisp touched your face, okay?
Okay.
Now close your eyes, ma'am. Okay.
Now. 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 Now.
Okay. You may open your eyes. Okay. So the patient can discriminate or feel the cotton wisp while the cotton wisp touched her face. I will now proceed in testing the motor function by bilaterally palpating the masseter and temporalis muscles while the patient clenches their teeth. Mom, can you please clench your teeth? Okay. Then I will feel your muscles, masseter muscles, and temporalis muscle. Then can you please open your mouth? Then close them. Okay. So the patient can clench their teeth and symmetrically open and close her mouth. For the cranial nerve 7, or the facial nerve, I will first assess the motor function by looking at the symmetry of facial muscles during movement. So, mom, can you please raise your eyebrows, then move them down, then smile, frown, and puff cheeks, then close your eyes tightly, then open them. So the facial muscles are symmetrical during movement. I will now move on to testing the sensory function by letting the patient taste 3 different applicators moistened with salt, sugar, and calamansi separately, while the eyes are closed. So, mom, close your eyes, then stick out your tongue. I will let you taste 3 different substances, then you must identify their taste, okay? So now close your eyes, Then open, stick out your tongue. Okay, so here's the first one. Stick out your tongue, Mom. What taste it is?
Sweet.
Okay, you're correct. Then here's the second one. Please stick out your tongue.
Salty.
Okay, correct too. Then please stick out again your tongue.
Sour.
Okay. All three tastes, you've identified it. So the patient correctly identified the three tastes that I have letter taste. For the eighth cranial nerve or the vestibulocochlear nerve, I will first test the auditory function by performing a whispered voice test. So Mom, can you please occlude your right ear first while I whisper something to you and you must identify what I have said, okay?
Okay. Shinjae and 15.
Okay, correct. Then to the other side. Please occlude your left ear, okay?
Brisbane, Australia 12.
Okay, correct. Then I will also test for balance using a Rombridge test. Mom, can you please stand up? Then keep your feet together, then your hands at the side, then please close your eyes. Then try to maintain this position for 20 seconds. So a normal result is a negative result wherein the patient maintains this position without falling down within 20 seconds. For the cranial nerve 9 and 10 are the glossopharyngeal and vagus nerve, I will check the patient's uvula and upper palate for symmetrical movement upon saying ah. So Mom, can you please open your mouth and say ah. Okay, once again. Okay. So the upper palate or the soft palate is in symmetry and the uvula rises symmetrically upon saying ah. The uvula and the tongue is also in midline position. Then I will also test for your gag reflex using the tongue blade. Okay, once again, can you please open your mouth? Okay. The gag reflex is intact. For the cranial nerve 11, or the accessory nerve, I will test the patient's sternocleidomastoid muscle strength by turning the head against resistance. So Mom, can you turn your head on the left against the resistance of my hand, okay? Okay, then turn your head to the left. Okay, then observe and palpate for the sternocleidomastoid muscle of the other side. Okay, it is normal and intact. Then again, can you please do it to the other side too? Turn your head to the right against the resistance of the head. Then observe and palpate for the sternocleidomastoid muscle of the other side. Okay, it is also intact. Then I will also test for the trapezius muscle strength by letting the patient shrug the shoulders against the resistance of my hand. Can you please shrug your shoulders upwards? Okay, it is also intact. For the cranial nerve 12 or the hypoglossal nerve, I will check the patient's tongue if it is in midline and if it can be moved without difficulty. So Mom, can you please stick out your tongue? Then move it sideways. Okay. So the patient's tongue is in midline and can be moved without difficulty. Then assess for muscle strength and sensation. Mom, can you please squeeze both of my fingers using both of your hands? Okay. As hard as you can. Then I will compare for bilateral strength. So the patient has bilateral strength in squeezing both of my fingers. So now, Mom, extend your forearms in front of you towards yourself against the resistance of my hands here. Okay. So now pull. Okay. So the patient bilaterally pulls both arms against the resistance of my hands. Then also for the lower extremities, mom, using both of your lower extremities, pull this to yourself. Pull your lower extremities to yourself against the resistance of my hands. Okay. Pull. Pull. Okay. So the patient bilaterally pulls both lower legs against the resistance of my hands. Then I will now assess the patient's coordination and balance by asking the patient to walk to assess her gait for smoothness, coordination, and arm swing. Mom, can you walk over there normally, then come back here? And come back here. Then next, I will ask you to walk up to there using heel to toe method. But you must maintain looking straight ahead, okay, like this one. One, heel to toe, then heel to toe, heel to toe, heel to toe. Okay. Then I will ask you to walk using your heels like this. Your turn. Walk using your heels. Okay. Then walk on tiptoes. Like this. Walk on tiptoes. So the patient's gait is normal, is also smooth, coordinated, and has appropriate arm swing. I will now also assess for the cerebellar functioning using such tests such as Romberge test, pronator drift, rapid alternating hand movement, finger to nose, and heel to shin test. First is the Romberge test. So mom, can you please keep your feet together and your arms on the side? Then close your eyes. Then try to maintain this position for 20 seconds. So the patient maintains this position for 20 seconds. Hence the Romberge test is negative, and which is also the normal result. Okay. So moving on to the pronator drift, I will also ask you to close your eyes while extend your arms with at the shoulder level with your palms facing upwards. Then close your eyes, then try to maintain this position for about 20 seconds too. So the patient also has a negative result in the pronator drift because her palms are maintained in this position and do not drift to the side. Okay, so moving on, we will now proceed to fingertip to nose test. So extend both of your arms. Then point your fingertips, point your index finger to the side. Then using your right hand touch your fingertip. Then extend it again. Then using your touch your nose with your left hand. Then do these alternate movements at a fast pace as you can. Now is your turn. 1, 2, 3, go. Or you can stop now. So the patient can maintain this alternating touching right and left index finger. Her nose. So moving on to the next test, the rapid alternating hand movement. So mom, please extend your arms on your thighs with the palms face downwards. Yeah. Then turn your hands so that the palms face upwards like this. Then turn again your hands to the downside. Then make these alternating movements as fast as you can. 1, 2, 3, go. Now you can stop now. So the patient can maintain this alternating motion with the rhythm, rate, and movement being maintained as the pace increases. So for the heel to shin test, mom, can you please touch the heel of your right foot just under the left kneecap? There. Then glide it in a straight line towards your ankle. Okay. Then do it on the other side. The left heel down the shin up to the ankle of the right leg. Okay. So the patient can easily glide down her heel on the shin bone towards the ankle. So the result is normal. So moving on, we will now assess the sensory function of the patient by testing the 5 areas of sensation such as the pain, touch, vibration, position sense, and discriminative sense. So we will test pain using a blunt object. We will apply a light pressure on the patient's shoulders, arms, and legs, comparing both sides and proximal and distal areas. So ma'am, I will apply light pressure to your body using the blunt part of this paper clip, but I will ensure that I will not prick you. Then you must say now. Can you repeat it now?
Now.
Now. Whenever you felt that sensation, okay.
Okay.
Then close your eyes now. Okay.
Now. 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 Now.
Okay. So the patient can feel every single time that apply light pressure to her shoulders, arms, and legs. Then we will now proceed to testing the light touch. The same procedure as before, we will apply light pressure to the patient's shoulders, arms, and legs, but now we will use a cotton wisp. So ma'am, the same as before, you must say now whenever you felt the sensation, but this time I will use a cotton wisp. This is a cotton wisp. You must also close your eyes for this procedure. Okay.
Now. 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 Now.
So the patient light touch is intact because she can feel every time that I apply light pressure using the cotton wisp on her body. Okay. So for the next test, we will test for the vibration. So I will touch the patient's distal interphalangeal joint of the finger or toe, but in this situation I will use the patient's finger. Then I will place over the joint a lightly tapped tuning fork. Let's just say that this is a tuning fork, 1/28 Hz tuning fork. This is vibrating now. Then I will place it over to the joint. Then I will ask the patient what the sensation is. Mom, what do you feel when I place it over here?
I feel a vibration.
Okay. So tell me when this vibration stops, okay?
It stopped.
Okay. So the vibration sense of the patient is intact because she reported this sensation as a vibration, and the vibration stops at almost at the same time that the examiner, which is me, felt that the vibration has stopped. So we will now move on to examining the position sense. So for examining the position sense, I Mom, I will move your thumb upwards or downwards while your eyes are closed. Okay? Now close your eyes. So I will grasp the patient's thumb at the sides, not at the bottom and top, because doing so will help the patient this identify the position sense even though the proprioception is impaired. Okay. So I will now move it down.
Down, 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 up, down, up.
Okay. So you can now open your eyes. So I will also repeat this test to your great toe. The same as before, you must close your eyes for this procedure. I will now move it now.
Down, down, up, down.
Okay. You may open your eyes. So the patient's position sense is intact because she can identify whether I move her thumb and great toe upwards or downwards. Then for the last test in this sensory function test, we will test the patient's discriminative sense using stereognosis in this situation. I will place a familiar object on the patient's palm and let her identify what it is while her eyes are closed. So ma'am, with your eyes closed, I will put something here in your arm, then you must identify what it is, okay? Now close your eyes. Then feel what it is.
A coin.
Okay. You can open your eyes now, okay? It's correct. So the patient's discriminative sense is intact because she can identify what object it is that I placed on her palm, which is a coin. Then, assess the patient's reflexes. First, assess the patient's deep tendon reflexes, such as the biceps, brachioradialis, triceps, patella, and Achilles reflexes. Mom, please place your arm on your thigh and support it there. Okay. Then I will locate the brachioradialis tendon on its insertion point on the radius. Okay, so there. Then I will tap it with the reflex hammer and looking for the flexion and supination of the forearm. Okay, so the brachioradialis reflex is present, and I will move on to the triceps reflex. Mom, can you please relax your finger and allow it to be supported by my hand, okay? I will support my hand underneath the biceps for the arm to maintain a midline between flexion and extension. Then locate the triceps tendon just above its insertion point on the olecranon process. Then tap it briskly, looking for the extension of the forearm. Okay, so triceps reflex is also present. Now we will test for the patella reflex. Looking for the extension of the lower leg. Okay, so the patella reflex is also present. Then we will now move on to testing the superficial reflexes, such as the plantar reflex or the Babinski reflex, and other pathological reflexes such as the snout reflex, rooting reflex, and the grasp reflex. Mom, can you please raise your leg and allow it to be supported by my hand? Okay, then I will just remove your slippers for a while. Then stroke the lateral soles of the foot up to the toes, looking for the flexion of the toes. Okay, so the Babinski reflex is negative and it is normal. So we will now test for the snout reflex by tapping the lips with the tongue blade. Okay, so the snout reflex is negative since it does not cause of the pouting of the lips. We will now test for the routine reflex by stroking gently the upper lateral side of the lip. So the routine reflex is also negative because it does not cause the movement of the mouth to the stimulus. Then we will now test for the grass reflex by lightly stroking the palm with my finger. Can you please show me your palm? Okay. Okay. So the grass reflex is also negative because it does not cause for the patient's fingers to flex and grasp my hand. Using the Glasgow Coma Scale, assess the patient's general neurologic condition. With the interview and test done, I observed that the patient's eye-opening response, verbal response, and motor response are in top condition and has a total score of 15. The patient's eyes open spontaneously, and she is oriented to person, place, and time. And she also obeys motor commands well. The neurological assessment is done, and I will now assist my patient to a comfortable position. Ask and if she have any questions left, and thank her for her time. Mom Julia, the neurological assessment is now done. Do you have any questions?
No.
Okay, Mom. Thank you for your time.
Thank you very much.
So before leaving the room, ensure 5 safety measures. The call light must be within reach. The bed must be in lowest position and locked. The side rails must be secured. The table must also be within reach, and the room must be risk-free for falls. Then perform hand hygiene and other infection control procedures. Document the assessment findings and report any concerns according to agency policy.